Recording.
Hi, I'm Shahid Shah, and I'm an entrepreneur in residence at the AHIP Innovation Lab. AHIP's Innovation Lab is where America's premier health insurance companies and their ecosystem partners collaborate to first define innovation requirements and then find or create solutions that will help solve immediate and long-term pressing challenges. I'm helping to organize and will be a moderator of the upcoming HL7 Partners in Interoperability Summit taking place March 21st and 22nd in Atlanta. So what is HL7 and why might you want to attend the HL7 Partners in Interoperability? HL7 is the organization that is behind the HL7 standard, which has been the driving force behind all data exchange in the clinical world for decades. It's been here for a long time, it's been working, and it's something that we can depend on and have been depending on for many years. They created the standards that allow multiple computer systems within hospitals to be connected and share data. HL7 is the reason that electronic health record systems today are able to connect with lab systems to connect with pharmacies, imaging systems, a variety of different systems within institutions have been using HL7 standards for decades. A new standard is emerging though, called HL7 FHIR, that goes beyond just connecting inside an institution and instead focusing on the connection outside of those institutions as well. So HL7 is the standard development organization that has created FHIR, and FHIR is one of those standards which is working today, and it's in fact doing a really good job of inter-institution, between institutions, as well as intra-institution, connecting data within an institution. But we're seeing that there's a lot of potential that's not fully being realized yet, primarily because there are many, many partners in the ecosystem that don't understand how FHIR can actually be used and provide enormous amounts of value. So FHIR is very easy for people to use, but they need to get together and understand which data they can exchange. So the HL7 Partners in Interoperability is helping bring those people together to understand how to better connect and communicate the existing use cases, new use cases, and a variety of other techniques and technologies that can be used to help make sure that interoperability becomes real. So what is the HL7 Partners in Interoperability Summit and who attends? I like to think that the Partners in Interoperability is really not so much about the technology, although an enormous amount of conversation happens about technology. But really, the Partners in Interoperability is unique because it brings together participants from health systems, insurance companies, pharmaceutical manufacturers, pharmacies, the public sector, and really bringing together these multiple industry segments to one gathering and to talk first and foremost about why is it so hard to do interoperability today. Once the senior executives that are there, once the business analysts that are there, once engineers and architects that are there understand why interoperability is so difficult, then they can move on and help their internal institutions as well as people across the ecosystem improve that capability. People talk a lot about data blocking, and almost everybody complains and points fingers at each other about why interoperability is not happening today. And really, the simple problem is that we don't have clinical interoperability because we don't have business interoperability. We cannot seem to get multiple providers together to agree on what they need to connect and share. We can't get insurance companies to agree with healthcare providers, we can't get the healthcare providers to agree with pharmaceutical companies, the pharmaceutical companies don't agree with pharmacies themselves. So when we put everybody together into a single event, like the Partners in Interoperability, we think that we're going to be able to move faster and easier towards a more interoperable future. Now, one of the big use cases that we're going to focus on at the Partners of Interoperability Summit in Atlanta is going to be on value-based care. And that will be our key focus because there's no way to pull off value-based care or outcomes-driven care without being able to pull multiple institutions together and getting them to interoperate. Now, the Partners Interoperability Summit is happening for a number of years, and the last few summits that we've held were really exciting because in about a 1.5 or 1 3/4 day event with very frank conversations, we got people together to help with strategic planning, but most importantly, beyond talk, was how do we move to practical outcomes and driving innovation to an area where it can actually be meaningful to patients and the institutions that are helping take care of them. We saw at previous events that FHIR is here today and is solving real world problems, but that we're only at the beginning. There's still a ton of potential that FHIR has yet to realize. The Partners Interoperability has panel discussions, education sessions, breakout sessions, and we emphasize immediate and practical initiatives that can be undertaken so that interoperability becomes a given, not just a dream, not just utopia. Senior executive business analysts and architects are being pulled together into a single place where they can go beyond the technology and figure out and say, if I got the tech to work, which is almost a given these days, what do I need to do to get agreement in a value-based care use case scenario so that I can move beyond just talking about information sharing and actually doing it and making it matter to patients. We've all learned that the low-hanging fruit of interoperability, which is the ability for systems internally to connect to a single institution and moving beyond from a single to multiple institutions, is now exhausted. What we need to do is to involve multiple stakeholders across multiple institutions to make value-based care and patient-focused care possible. So, what is value-based care and why does it matter to payers, providers, pharmaceutical companies? Well, there's a lot of talk about value-based care, but really it's very hard to pull off because it requires information asymmetry problems to be corrected. Some organizations have a lot more information than other organizations do about that same information. And what we need to really do is to make sure that we understand that our fees for services model is unsustainable because it's not focused on outcomes and it encourages disjointed care without regard to patients and their caregivers' long-term clinical results. Value-based care is the one thing that I think that we can all agree on that we need to pull together around and ensure that we can make it happen so that patients can get better benefits today, not years or decades from now. So this is your opportunity to network with your peers and solution providers who have successfully implemented FHIR. Here you can learn about FHIR and how it's being incorporated into electronic health record systems, lab systems, imaging systems, in fact systems you may not even know that have the ability to connect with FHIR. And you can learn how to benefit from the APIs and that will become part of Meaningful Use 3 and why you should start to incorporate them into your architecture today. It's very inexpensive. It's only about $250 for members and $300 for non-members of HL7. And that includes continental breakfast, lunch both days, and networking reception after the first day. And really, it's done in Atlanta, Georgia, which is a hotbed of health IT today. And so coming to the Georgia Tech Research Institute, where it's going to be an exciting time, is something you should hopefully plan for. So I look forward to seeing you in March at the HL7 Partners in Interoperability event. Thank you.